ನಮಸ್ಕಾರ, ನಾನು ದೀಕ್ಷಾ ಬಂಗೇರ. ಫಾದರ್ ಮುಲ್ಲರ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜು ಮತ್ತು ಆಸ್ಪತ್ರೆ ಅರ್ಪಿಸುವ ಆರೋಗ್ಯ ಕಿರಣ ವೈದ್ಯಕೀಯ ಮಾತುಕತೆ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ. ಇತ್ತೀಚಿನ ದಿನಗಳಲ್ಲಿ ಮಹಿಳೆಯರಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಹೆಚ್ಚಾಗ್ತಾ ಇದೆ. ಇದು ಯಾಕೆ ಬರುತ್ತೆ, ಇದಕ್ಕಿರುವ ಟ್ರೀಟ್ಮೆಂಟ್ ಯಾವುದು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಫಾದರ್ ಮುಲ್ಲರ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜಿನ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ವಿಭಾಗದ ಸಹಾಯಕ ಪ್ರಾಧ್ಯಾಪಕಿಯಾಗಿರುವ ಡಾಕ್ಟರ್ ಆಕಾಂಕ್ಷ ರಾಜ್ಪೂತ್ ರಾವ್ ಇದ್ದಾರೆ. ಡಾಕ್ಟರ್, ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಸ್ವಾಗತ.
ಥ್ಯಾಂಕ್ ಯು ಸೊ ಮಚ್. ಹಾಯ್ ದೀಕ್ಷಾ.
ಮೊದಲನೇದಾಗಿ ಈ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅನ್ನೋದು ಹೇಗೆ ಬರುತ್ತೆ ಅಂತ?
So, breast cancer is the leading cancer amongst all the females, both in India and the world.
Okay.
So, it's continuously increasing in number, both in the cities and in our state and this area as well.
Okay.
So, everybody needs to be aware of this condition very well.
Okay.
ಅವ್ರಿಗೆ ಭಯ ಆಗ್ತದೆ, they don't come in front, they don't get checked. So they really need to be aware, and that's why we have come here to get this talk in that place.
Yes. ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಒಂದು ಡಿಸೀಸ್ ಮಾತ್ರ ಅಲ್ಲ, ಲೈಫ್ ಚೇಂಜ್ ಮಾಡುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಅದು ಹೇಗೆ ಅಂತ?
So it's not just a physical disease, it's a life-changing diagnosis for a woman. So usually a breast is identified as one's identity, a woman's identity, her femininity, or atma vishwasa. So when she's told she has cancer, what happens is ಅವರಿಗೆ ಭಯ ಆಗ್ತದೆ, ಪ್ರಾಣಕ್ಕೆ ಅಪಾಯ ಆಗ್ತದೆ, ಅವರಿಗೆ ಅದು ಭಯ ಆಗ್ತದೆ, ಓ ನಂಗೆ ಅದು ಬ್ರೆಸ್ಟ್ ಇರೋದಿಲ್ವಾ ಈಗ. ಸೊ ವಿ ಹ್ಯಾವ್ ಟು ಟೆಲ್ ದೆಮ್, ವಿ ಹ್ಯಾವ್ ಟು ಮೇಕ್ ದೆಮ್ ಅವೇರ್ ದಟ್ that's not just about removing the cancer, but we can also restore their identity. We can restore the breast again so that they can feel normal again. So that is where after the breast cancer surgery ಅವರಿಗೆ ತುಂಬಾ emotional stress, ಮನಸ್ಸಿನ ಮೇಲೆ ತುಂಬಾ impact ಬರುತ್ತೆ. So we as plastic surgeons try to help them by restoring their identity, restoring the breast shape and everything.
Okay. So ಈಗ ಈ ಸಂದರ್ಭದಲ್ಲಿ ಇವಾಗ ಯಾರಾದರೂ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಏನಾದರೂ ತುತ್ತಾಗಿದ್ರೆ ಇವರಿಗೆ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಯಾವ ರೀತಿ ಆಗುತ್ತೆ ಅಂತ?
So once the surgery of the cancer is done, the cancer is removed, ನನ್ನ role is to reconstruct the breast again. So ನಾನು ಬೇಸಿಕಲಿ ಅವರಿಗೆ ಎಲ್ಲ ಅದು ಟಿಶ್ಯೂ ಮತ್ತು ಇಂಪ್ಲಾಂಟ್ ತಗೊಂಡು ಅವರಿಗೆ ಬ್ರೆಸ್ಟ್ ರೀಕನ್ಸ್ಟ್ರಕ್ಟ್ ಮಾಡ್ತೀವಿ. ಸೊ ಅವರಿಗೆ ಯೂಶಲಿ ದಿಸ್ ಆಪ್ಷನ್ ದೇ ಆರ್ ನಾಟ್ ಅವೇರ್ ಆಫ್. ಸೊ ವಿ ಆಸ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜನ್ಸ್ ಹೆಲ್ಪ್ ದೆಮ್ ಇನ್ ರೀಸ್ಟೋರಿಂಗ್ the breast shape and size and symmetry. At the same time, it also gives them a lot of psychological support, which helps in recovery. So in a way, we just do not do the surgery, we are also helping them to get back to a normal life. That is very important.
ಇದು ಎಷ್ಟು ಕಾಮನ್ ಆಗಿದೆ ಮ್ಯಾಮ್?
ಇದು ಸರ್ಜರಿ?
ಎಸ್, ಅಲ್ಲ ಇದು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅನ್ನೋದು ಎಷ್ಟು ಕಾಮನ್ ಆಗಿದೆ? ಇದರಲ್ಲಿ ವರಿ
ಸೊ breast cancer in India per se is 1 in 3,000 women every year is getting affected. So it could be because of many reasons. Tumba reasons are there. Basically what is happening is there's a lot of lifestyle changes where there's lack of physical activity, ಜಾಸ್ತಿ weight ಇರೋದು, ಅವರು physical activity ಮಾಡ್ತಾ ಇಲ್ಲ, plus a lot of stress at work, at personal life. Then they also have a lot of other things happening in their life because of which it can happen. They in their family they have cancer but they are not aware of it. So a lot of reasons are there because of which it can happen, but they are not aware of it, hence they do not come in front. But the good news is that once it is detected early, they do know, they have this information, they can easily come to us and we can give them the best treatment. So it can be treated completely and successfully, but many people are not really aware of it. So ಅದಕ್ಕೆ ಜಾಗೃತಿ ಮಾಡಬೇಕು.
Yes. ಈಗ ಏನಾದರೂ ಇವಾಗ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಅಂದಾಗ ಏನಾದರೂ ಫುಡ್ಡಿಂದ ಆ ಥರ ಎಲ್ಲ ಬರುವಂಥದ್ದು ಏನಾದರೂ ಇದೆಯಾ? ಅಥವಾ ನಾವೇನಾದರೂ ಈ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ನ ನಾವು ಒಂದು ಸ್ವಲ್ಪ ಸಣ್ಣ ವಯಸ್ಸಿಂದಲೇ ಅವಾಯ್ಡ್ ಮಾಡಬೇಕು ಅಂತಂದರೆ ಇಂಥದ್ದೇ ಫುಡ್ ಸಿಸ್ಟಮ್ ಆಗಿರ್ಬೋದು, ಇಂಥದ್ದೇ ಯೋಗ ಆಗಿರ್ಬೋದು, ಈ ಥರದ್ದು ಏನಾದರೂ ಇದೆಯಾ?
Correct. Yes. So basically you have to follow a very healthy lifestyle. Yes, you can do yoga as well if that helps you. Meditation you can do. But more importantly, you need to have the knowledge, you need to have the awareness about it. And more and more, if you connect with other females, connect with other people in the family, your friends, their extended network, you will get to know about this more, that it is more common in the females. So more the females know about it, more the network amongst each other, there is a lot of awareness. So adike not just the physical activity, but a lot of emotional support amongst the females also
Okay.
is very important. So all these small groups you can form, and you can go and tell each other, okay, this is the way you have to go. You have to go and show the doctor. You have to examine yourself like this in front of the mirror while sleeping, while lying down. So all that is very important.
Okay.
Not just the physical
Okay.
activity. Like you don't have to just exercise to prevent breast cancer. You have to do other things as well. You have to
Okay.
be mentally also very stable. That's
ಓಕೆ
all.
ಇವಾಗ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅಂತ ಬಂದಾಗ ಸರ್ಜರಿಯಲ್ಲಿ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಏನನ್ನ ಮಾಡ್ತಾರೆ ಅಂತ
So we mainly have two options.
Okay.
One is implants. So implants, andre silicone implants. So people think that silicone implants are only cosmetic surgery. Or girls usually are very crazy about silicone implants. But ataralla, we have implants to fill up the volume after the cancer is removed from the breast. So that is there. Plus we have a second option where we use the woman's own breast tissue, and we take it from her tummy, we take it from the back,
Okay.
we take it from the thigh, we transfer it to the breast to make it look like the other breast.
Okay,
So in a way it looks like a very naturally looking soft consistency breast. So they don't have to worry about wearing padded bras after the surgery and everything. So they can really go back to the normal life, waking up from the surgery as if nothing has happened. Absolutely. So they are more confident, and they are more confident to go into the stepping into the normal life and recovering very speedily.
ಓಕೆ
Yes.
ಇವಾಗ ಒಂದಿಷ್ಟು ಹುಡುಗಿರು ಅನ್ಕೋತಾರೆ, ಯಾಕಂತಂದ್ರೆ ಬ್ರೆಸ್ಟ್ ರಿಮೂವ್ ಮಾಡಿದ್ಮೇಲೆ ಜೀವನನೇ ಮುಗ್ದೋಯ್ತು ಅನ್ನೋ ತರ ಇರ್ತಾರೆ, ಅದು ನಿಜಾನಾ
Correct, yeah.
ಅಥವಾ ಏನು ಅಂತ?
So I can totally understand that. I can relate to that. We as female identify ourselves with our own feminine nature, with our breast, with our entire body connects with that. But the thing is that when they undergo this surgery, there's a lot of emotional trauma. When they lose the breast, there's a lot of depression that can happen beyond that. And nobody addresses that, nobody knows that. Even the males in the family, the husband, the brother, the son, nobody will understand that. So adike nanu as plastic surgeons, we have that role, we assume that role, that we'll go forward, we'll reconstruct that breast, we'll help them rebuild that confidence, that body image, so that they can step out, they can wear whatever they want, and they can feel normal again. So that is how I feel like they can look normal, they can feel confident again, and they do not have to hesitate about it at all. Yes.
ಓಕೆ, ಈಗ ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ಸ್ಗೆ ಯಾವುದೆಲ್ಲ ಆಪ್ಷನ್ಸ್ ಇದೆ ಅಂತ?
So this options I already, as I told, like implants are there. Then we can also do the tissue transfer surgery, which is the tummy and the back and
Okay.
everything. So that is called as flap reconstruction. And then there are final tweaking procedures where we can transfer fat from your tummy, from your thigh, and put it here. We can reconstruct the nipple, we can reconstruct the areola, we can do small tweaking surgeries to make both the breasts look symmetrical.
Okay.
So we are not just chasing the surgical aspect, we are trying to achieve the patient's goal to have maximum satisfaction and a naturally looking breast.
ಓಕೆ,
That's all. Yes.
ಇವಾಗ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಅಲ್ಲದೆ ಇರೋರಿಗೆ, ಇವಾಗ ನಾರ್ಮಲ್ ಆಗಿ ಹುಡುಗಿಯರಿಗೆ ಅವರು ಒಂದು ಲುಕ್ಗೋಸ್ಕರ ಈ ಪ್ಯಾಡೆಡ್ ಬ್ರಾಸ್ಗಳನ್ನೆಲ್ಲ ಯೂಸ್ ಮಾಡ್ತಾರೆ,
Correct,
ಅದು
yeah.
ಒನ್ ಆಫ್ ದ ರೀಸನ್ ಆಗ್ಬಹುದಾ ಈ ಒಂದು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ಗೆ ಎಲ್ಲ?
ಇಲ್ಲ, that is not related at
ಓಕೆ,
all.
ಸೋಷಿಯಲ್
Not
ಮೀಡಿಯಾದಲ್ಲೆಲ್ಲ ತೋರಿಸ್ತಾ ಇರ್ತಾರೆ.
No. They just wear it maybe because they are maybe smaller in size, or some people what they do is they choose after the surgery is done, they want the cancer to be completely removed.
Okay.
Till then they wear those padded bras.
Okay.
And once they are ready to take the plastic surgery from our end, then they can come to us anytime after the cancer treatment completion, and we can do the surgery for them. Definitely, yes.
ಓಕೆ, ಈ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಅಂತ ಹೇಳ್ತಾರಲ್ವಾ, ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಸರ್ಜರಿ, ಸೊ ಆಗ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಏನ್ ಮಾಡ್ತಾರೆ ಅಂತ?
Okay, so the cancer surgeon here, he does the goal main here for him is to remove the cancer completely. So ಅವರಿಗೆ two options ಇದ್ದಾರೆ. So first option is if the tumor is ಚಿಕ್ಕ ಇದ್ದಾರೆ, ಸ್ವಲ್ಪ ಚೂರ್ ಇದ್ದಾರೆ ಪೋರ್ಷನ್ ಅಲ್ಲಿ ಬ್ರೆಸ್ಟ್ ತೆಗಿತವೆ, ಅದು that is called as breast conservation surgery. ಮತ್ತೆ ಇನ್ನೊಂದು ಆಪ್ಷನ್ ಇದ್ದಾರೆ, ದಟ್ ಇಸ್ ಟ್ಯೂಮರ್ ತುಂಬ ಜಾಸ್ತಿ ಆಗಿದೆ, ಆರ್ಮ್ಪಿಟ್ ತನಕ ಹೋಗಿದೆ. ಸೊ that time we remove the entire breast along with some nodes in the armpit. So that is called as mastectomy.
Okay.
And usually these both surgeries are safe, And with the modern techniques, the patient can achieve very good successful treatment results, and they need not worry about it at all. Yes.
ಇಂಪ್ಲಾಂಟ್ಸ್ ಸೇಫಾ? ಜನರು ಯಾಕೆ ಭಯ ಪಡ್ತಾರೆ ಈ ವಿಷಯಕ್ಕೆ?
Okay, so there's a lot of myth about it that implants can cause cancer, it can interfere with breastfeeding, atara. But there is no such thing. With very modern implants that are currently being used, both in cosmetic surgery world plus in reconstruction world, they are absolutely safe. Adu idu body alli enta side effects madalla, and they are long lasting. Complication rate is very less. If maintained properly and the post-operative protocol is followed properly, they are extremely safe. So patients should not have any fear against or any doubts against implants, because the treatment, reconstruction treatment, is very customized for each patient that comes to us after cancer surgery.
ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಸರ್ಜರಿ ಯಾವಾಗ ಮಾಡ್ತಾರೆ? ಅಂದ್ರೆ ಇವಾಗ ಗೊತ್ತಾದ ತಕ್ಷಣನ ಅಥವಾ ನಂತರನ, ಯಾವ ತರ ಅಂತ?
ಓಕೆ, ಸೊ ಕ್ಯಾನ್ಸರ್ ಕ್ಯಾನ್ಸರ್ ಸರ್ಜರಿ ಆದಮೇಲೆ 2 ಆಪ್ಷನ್ಸ್ ಇರೋದು. ಸೊ ಫಸ್ಟ್ ಆಪ್ಷನ್ ಇದು ಇಮಿಡಿಯೇಟ್, ವೇರ್ ಕ್ಯಾನ್ಸರ್ ರಿಮೂವ್ ಮಾಡುತ್ತೆ ಅವರು, ಮತ್ತೆ ನಾವು ಅದು ರೀಕನ್ಸ್ಟ್ರಕ್ಷನ್ ಮಾಡುತ್ತೆ. So the advantages here is the patient wakes up with a breast again, so there is no defect at all. So she also feels better from inside and out. There is a lot of goodwill there from our side. They also receive it very well, and they feel confident again. There are less number of surgeries as well following that main surgery, and then there is a very speedy recovery there. Athwa then delayed reconstruction, adu cancer treatment fully completion ಆದ್ಮೇಲೆ 3 ತಿಂಗಳು ಆದ್ಮೇಲೆ ನಾವು breast reconstruction ಮಾಡ್ತೀವಿ. But then the problem is then the entire reconstruction gets delayed there, that's all. So they are roaming around with a flat chest, so they have to wear those padded bras that you spoke about, basically.
So ಈಗ ಇದೊಂದು ಸರ್ಜರಿ ಆದ್ಮೇಲೆ ಆ ಪೇಷಂಟ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಆಗಿರ್ಬೋದು, ಅವ್ರದ್ದು ಎಮೋಷನಲ್ ಇಂಪ್ಯಾಕ್ಟ್ ಹೇಗಿರುತ್ತೆ ಅವ್ರದ್ದು?
So the cancer surgery itself can cause a lot of trauma for both the female and the family. We can understand that. ಸೊ ಆದಮೇಲೆ ಇದು ಅವರಿಗೆ ತುಂಬ ಸೈಕಲಾಜಿಕಲ್ ಸ್ಟ್ರೆಸ್, ಅವರಿಗೆ ಸೋಷಿಯಲ್ ಸಿಚುವೇಶನ್ಸ್ ಬರೋಕ್ಕೆ ತುಂಬ ಅದು ಡೌಟ್ ಆಗ್ತದೆ, ಆ್ಯಂಡ್ ದೇ ಆಲ್ಸೋ ಫೀಲ್ ಲೈಕ್ ದೇ ಕೆನಾಟ್ ವೇರ್ ಆಲ್ ದ ಕ್ಲೋತ್ಸ್ ದಟ್ ದೇ ವಾಂಟ್. ಸೊ ಆಲ್ ದ್ಯಾಟ್ ವಿತ್ ಪ್ಲಾಸ್ಟಿಕ್ ಸರ್ಜರಿ ಇನ್ ದ ಪಿಕ್ಚರ್ ಕ್ಯಾನ್ ರಿಯಲಿ ರಿಸ್ಟೋರ್ ದ್ಯಾಟ್. ವಿ ರಿಸ್ಟೋರ್ ಬೋತ್ ದ ಬಾಡಿ ಶೇಪ್, ವಿ ರಿಸ್ಟೋರ್ ದ ಬ್ರೆಸ್ಟ್ shape, symmetry as per the body. We also give them a lot of confidence during that process. There's a lot of counseling involved, so we can really restore their identity in this process, and they can really feel normal again. So they should not hesitate in opting for reconstruction at any point of time after the cancer treatment. They should really come forward.
ಇದು ರಿಕವರಿ ಪ್ರಾಸೆಸ್ ಹೇಗಾಗುತ್ತೆ ಮ್ಯಾಮ್?
So recovery is pretty much normal like any other surgery. It mostly takes 3 to 4 weeks. So ನಾವು ಅದು ಪೇನ್ ಕಂಟ್ರೋಲ್ ಮಾಡ್ತೀವಿ, ಅವರಿಗೆ ಅದು ಭುಜ ಮತ್ತು ಕೈಯಲ್ಲಿ ಅವರಿಗೆ ಎಕ್ಸಸೈಸ್ ಕೊಡ್ತೀವಿ, ಡೈಲಿ ಡ್ರೆಸ್ಸಿಂಗ್ಸ್ ಕೊಡ್ತೀವಿ, ಮತ್ತು ಬೇರೆ ಏನಾದರೂ ಚಿಕ್ಕ ಸರ್ಜರೀಸ್ ಇದ್ದಾರೆ ದ್ಯಾಟ್ ವಿ ಆಲ್ಸೋ ಅಡ್ವೈಸ್ ದೆಮ್ ಫಾರ್ ಲೇಟರ್ ಆನ್ ಸ್ಟೇಜಸ್. ಸೊ ಪ್ರಿಟಿ ಮಚ್ ದೇ ಕ್ಯಾನ್ ಗೋ ಬ್ಯಾಕ್ ಟು ದೇರ್ ನಾರ್ಮಲ್ ಲೈಫ್ ಇನ್ 2 to 3 weeks ಈಸಿಲಿ. ದೇ ವುಡ್ ಫೀಲ್ ಲೈಕ್ ನಥಿಂಗ್ ಹ್ಯಾಪನ್.
ಎಸ್, ಈಗ ಕೊನೆಯದಾಗಿ ನಮ್ಮ ಈ ಒಂದು ಮಹಿಳೆಯರಿಗೆ ನಿಮ್ಮ ಮೆಸೇಜ್ ಏನು ಅಂತ?
Okay, so my message is really simple. So breast cancer treatment is not the end, and you do have options. You can look normal again, you can feel confident again. ಅದು ಕ್ಯಾನ್ಸರಲ್ಲಿ ಭಯ ಪಟ್ಕೋಬೇಡಿ, ಸರ್ಜರಿ ಬಗ್ಗೆ ಭಯ ಪಟ್ಕೋಬೇಡಿ. ಯು ಕ್ಯಾನ್ ಕಮ್ ಫಾರ್ವರ್ಡ್, ಸೀಕ್ reconstruction treatment. Cancer treatment is definitely not the end. Reconstruction also will complete your life. So it's just the beginning and not the end. Okay? Yes, thank you.
Thank you, ಡಾಕ್ಟ್ರೆ.
ಧನ್ಯವಾದಗಳು.
ಒಂದು ಒಳ್ಳೆ ಕಾರ್ಯಕ್ರಮದಲ್ಲಿ ಒಂದು ಒಳ್ಳೆ ಮಾಹಿತಿಯನ್ನು ನೀಡಿದ್ದಕ್ಕೆ. ನೋಡಿದ್ರಲ್ವ ವೀಕ್ಷಕರೇ, ಫಾದರ್ ಮುಲ್ಲರ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜು ಮತ್ತು ಆಸ್ಪತ್ರೆ ಅರ್ಪಿಸುವ ಆರೋಗ್ಯ ಕಿರಣ ವೈದ್ಯಕೀಯ ಮಾತುಕತೆ ಕಾರ್ಯಕ್ರಮನ ಇಲ್ಲಿಗೆ ಮುಗಿಸ್ತಾ ಇದ್ದೀನಿ. ಮುಂದೆ ಇನ್ನೊಂದು ವೈದ್ಯರ ಜೊತೆ ಮತ್ತೊಮ್ಮೆ ಸಿಗ್ತೀನಿ ಅಂತ ಹೇಳ್ತಾ, ನಿರಂತರ ಸುದ್ದಿ, ಮಾಹಿತಿ, ಮನೋರಂಜನೆಗಾಗಿ ನೋಡ್ತಾ ಇರಿ V4 ನ್ಯೂಸ್.